Hello, this is Dodie from Deliberate Aging. Welcome to my podcast. Hello, everyone, and welcome back to the show. I'm so glad you're here with me today because we're diving into a topic that's been stirring up conversations across dinner tables, doctors' offices, and even retirement communities. Marijuana. Now, I know this might raise a few eyebrows. Some of you might be thinking, isn't that something for the younger crowd? Or maybe you've heard conflicting stories, some praising it as a miracle plant, others warning of its dangers. So today, we're asking a simple but important question. Is marijuana good for you, bad for you, or is it something more nuanced than we've been led to believe? Now, this isn't about promoting a lifestyle or pushing an agenda. It's about exploring a growing body of research, hearing from medical experts, and understanding how marijuana, particularly medical marijuana, is helping older adults manage chronic conditions, improve sleep, and reduce anxiety. And most importantly, it's about empowering you with information so you can make informed decisions about your own health. So, why are older adults turning to cannabis? Well, let's start with a surprising fact that might challenge some assumptions. Seniors are one of the fastest growing groups of marijuana users in the United States. That's right, folks over 65 are increasingly turning to cannabis, not for recreation, but for relief. And it makes sense, doesn't it? Aging often brings with it a few unwelcome guests: arthritis, insomnia, chronic pain, and sometimes anxiety or depression. Many older adults have spent years trying different medications only to find that the side effects are worse than the symptoms. Others are simply looking for a gentler, more natural way to feel better. Cannabis offers an alternative. It's not a cure-all, but for many, it's a tool that helps restore quality of life. Whether it's easing joint pain, helping with sleep, or calming the nerves, marijuana is becoming part of the wellness conversation for older adults. So let's take a look at some numbers to put this into perspective. A 2022 study published in JAMA Internal Medicine found that cannabis use among adults aged 65 and older increased by a staggering 75% over 5 years. In states where medical marijuana is legal, older adults report using it primarily for pain management, sleep improvement, and mood regulation. And according to a survey by the University of Michigan's Institute for Healthcare Policy, nearly 1 in 5 adults over 50 have tried cannabis in the past year, and most say they use it for medical reasons. So what's driving this shift? Well, it's a combination of factors: changing laws, changing attitudes, and a growing awareness that cannabis might offer relief where other treatments have failed. So what is medical marijuana? So before we go any further, let's break down what we mean by medical marijuana. Because for many people, the term still conjures up images of smoke-filled rooms and psychedelic trips. But that's not what we're talking about here. Marijuana comes from the Cannabis sativa plant, and it contains compounds called cannabinoids. The two most well-known and most studied are THC and CBD. Now, THC is the psychoactive component. It's what causes the high that recreational users seek. But in medical settings, THC is often used in very low doses to help with pain, nausea, and appetite. Now, CBD is non-intoxicating. It doesn't make you feel high, but it does interact with your body's endocannabinoid system to help regulate things like mood, sleep, and inflammation. So medical marijuana isn't just one thing. It comes in many forms. Depending on your condition and your comfort level, you might use oils and tinctures that you place under your tongue, capsules or tablets that you swallow like any other medication, edibles such as gummies or chocolates, which can be easier to dose, topical creams and balms for localized pain relief, or vaporizers, which deliver cannabinoids quickly without the smoke. So each method has its pros and cons. For example, edibles take longer to kick in, but last longer, while vaporizers offer fast relief but wear off more quickly. The key is finding what works for you, and that often takes a little trial and error. So what conditions can it help treat? Now that we understand what medical marijuana is, let's talk about what it's actually used for. Across the United States, medical marijuana is approved to treat a wide range of conditions. And while the list varies from state to state, here are some of the most common. Number 1, Alzheimer's disease. Some studies suggest cannabis may help reduce agitation and improve sleep. 2, HIV/AIDS. Marijuana can help with appetite loss and nausea. Number 3, Crohn's. Cannabis may reduce inflammation and abdominal pain. Number 4, epilepsy and seizures. CBD-based meds like Epidiolex are FDA approved for certain types of epilepsy. Number 5, glaucoma. THC can reduce intraocular pressure, though newer treatments may be more effective. 6, multiple sclerosis and muscle spasms. Cannabis may help reduce spasticity and pain. 7, post-traumatic stress disorder or PTSD. Especially among veterans, cannabis is used to manage flashbacks and anxiety. 8, chronic pain, one of the most common reasons older adults turn to cannabis. And lastly, nausea and vomiting from cancer treatments. THC-based drugs like dronabinol and nabilone are FDA approved specifically for this purpose. Now, it's important to note that while many states allow medical marijuana for these conditions, the rules vary widely. What's legal in New Jersey might not be legal in Texas. And while doctors in some states can recommend marijuana, they can't technically prescribe it because under federal law, marijuana is still classified as a Schedule I drug. So this patchwork of laws creates confusion for patients and providers alike. But despite the legal hurdles, more and more older adults are finding that cannabis helps them feel better, and that's worth talking about. So now let's discuss the legal confusion and federal versus state law. This is something that causes a lot of head scratching, the legal status of marijuana. If you've ever tried to look up whether you can use cannabis in your state, you've probably run into a maze of conflicting information. Here's the deal. Under U.S. federal law, marijuana is still classified as a Schedule I drug. That means it's considered to have no accepted medical use and a high potential for abuse, right alongside heroin and LSD. This classification makes it illegal at the federal level to possess, distribute, or prescribe marijuana. But here's where it gets complex. 38 states have legalized medical marijuana in some form. That means in those states, doctors can recommend cannabis to treat certain conditions, and patients can legally purchase it from licensed dispensaries. However, because of the federal restrictions, doctors can't technically prescribe it like they would antibiotics or blood pressure meds. This legal gray area creates confusion for the patients, who aren't sure if they're breaking the law or not, doctors, who worry about losing their medical licenses, and researchers, who struggle to get funding and approval for clinical trials. So let's look at an example. In New Jersey, where I'm recording this episode, medical marijuana is legal for conditions like chronic pain, PTSD, and cancer-related nausea. You need a doctor's recommendation and a state-issued medical marijuana card. But if you cross the border into Pennsylvania, the rules are different. And if you fly to Texas, well, you might be out of luck entirely. This patchwork of laws makes it hard to create consistent care. It also means that access to medical marijuana often depends more on your zip code than your medical needs. So what does the research say? Now, despite the legal hurdles, research into medical marijuana is growing, and the results are promising. So let's take a look at what science is telling us. Chronic pain. This is the #1 reason older adults turn to cannabis. And studies show that cannabinoids can reduce pain intensity, especially for neuropathic pain and arthritis. A 2020 review in The Lancet found that cannabis-based medicines were effective in reducing pain in patients who didn't respond to traditional treatments. Sleep disorders. Many older adults struggle with insomnia or disrupted sleep. Cannabis, particularly strains with higher CBD, can help regulate sleep cycles. A study published in Frontiers in Pharmacology found that cannabis use improves sleep quality in 70% of patients. Anxiety and depression. CBD has shown promise in reducing anxiety, especially in social situations. However, THC can sometimes worsen anxiety in high doses. That's why dosing and strain selection are so important. PTSD. Cannabis is increasingly used to manage PTSD symptoms, especially among veterans. It can help reduce flashbacks, improve sleep, and ease hypervigilance. The Multidisciplinary Association for Psychedelic Studies, or MAPS, is currently conducting trials on cannabis for PTSD treatment. Cancer-related nausea. The FDA has approved dronabinol and nabilone, which are synthetic THC medications, to treat nausea and vomiting caused by chemotherapy. These drugs have been used for decades, are considered safe and effective. But here's the catch. While observational studies and patient testimonials are encouraging, large-scale randomized clinical trials are still limited. That's because federal restrictions make it difficult to conduct research on cannabis. And until those barriers are lifted, we'll continue to rely on smaller studies and anecdotal evidence. Still, the momentum is building. More universities, hospitals, and governments are investing in cannabis research. And as the stigma fades, we're likely to see more robust data in the coming years. So let's now look at Israel's leadership in medical cannabis. Looking beyond our borders to a country that's leading the way in medical cannabis research. Israel has been at the forefront of cannabis science for decades. In the 1960s, Professor Raphael Mechoulam discovered THC and later identified the endocannabinoid system, which is a network of receptors in the human body that interacts with cannabinoids to regulate pain, mood, appetite, and more. And today, Israel's hospitals and clinics use cannabis to treat cancer pain, PTSD, neurological disorders like Parkinson's and epilepsy, and inflammatory conditions like Crohn's disease. And the Israeli government supports a national medical cannabis program which includes rigorous clinical trials, standardized dosing, physician education, and patient monitoring. Now, many U.S. companies conduct early-stage research in Israel because of its supportive regulatory environment. In fact, some of the most promising cannabis-based meds were developed or tested there first. Israel's approach offers a model for how cannabis can be integrated into mainstream medicine with safety, consistency, and scientific vigor. Now let's get practical. If you're curious about medical marijuana, the first step is to talk to your doctor. And I know that can feel awkward. Many older adults worry that their doctor will judge them or dismiss their concerns. But here's the good news. Attitudes are changing. More physicians are open to discussing cannabis, especially in states where it's legal. Some are even certified to recommend it. And here are a few tips for having that conversation. Be honest about your symptoms and what you've tried. Let your doctor know what's working and also what's not working. Ask about interactions with your current medications. Cannabis can affect blood pressure, blood sugar, and other systems. Start low and go slow. Especially with THC, it's best to begin with a very small dose and gradually increase if needed. And consider CBD-only options if you're concerned about intoxication. Many older adults find relief with CBD alone. Remember, your doctor is your partner in health, not your judge. And if your doctor isn't comfortable discussing cannabis, you can seek out a specialist or clinic that focuses on integrative medicine. So now let's listen to some of the expert voices. And here are my top 3 picks. Dr. Sanjay Gupta, neurosurgeon and CNN medical correspondent, quotes, "We have been terribly and systematically misled for nearly 70 years in the United States. It is irresponsible not to provide the best care we can as a medical community, care that could involve marijuana." Dr. Maria Torriella Carney, chief of geriatrics at Northwell Health, says, "Many older adults seek alternatives to opioids for managing chronic pain, arthritis, and other age-related ailments. Cannabis has become a valuable tool in helping reduce suffering, improve sleep, and enhance mental well-being. And finally, Dr. Peter Grinspoon, of Harvard Medical School, says medical cannabis is typically well tolerated among older adults, but as with all medications, there are side effects and downsides to consider, especially drug interactions and cognitive effects. Now, these experts help validate what many older adults already know from experience. Cannabis can be a safe and effective part of a comprehensive care plan. Now let's talk generational shifts. We'll take a moment to reflect on how far we've come. And for many older adults, marijuana was once seen as taboo, a dangerous drug associated with rebellion and addiction. But then baby boomers grew up during the reefer madness era and the war on drugs. They were taught that marijuana was a gateway drug that led to ruin. And then we talked Generation X. They inherited some of that skepticism, but also saw the rise of medical marijuana in the 1990s. And now we have millennials and Gen Z that view cannabis as a wellness tool, something as normal as herbal tea or yoga. So today we're definitely seeing a cultural shift. Older adults are rethinking the narrative. They're asking questions, doing research, and trying cannabis for themselves, not because it's trendy, but because it helps. The shift is being driven by increased media coverage of cannabis as medicine, legalization in dozens of states, and personal experiences with ineffective or harmful prescription drugs. And it's a reminder that healing doesn't always come from a pill bottle. Sometimes it comes from being open to new possibilities. Even with all the progress, stigma still lingers. Many older adults feel embarrassed or ashamed to admit they use cannabis, even if it's for legitimate medical reasons. But that's changing. Organizations like AARP now support medical marijuana use for older adults in states where it's legal. They encourage open conversations with healthcare providers and advocate for more research. A CBS News report highlighted seniors at a retirement community who openly use cannabis edibles at social gatherings. They talk about it the way others talk about wine or supplements. And still, some older adults feel like they're asking for permission to break the law when they bring it up with their doctors. And that fear can prevent people from getting the help they need. Now, reducing stigma means normalizing cannabis as a medical tool, not a recreational vice, encouraging respectful, informed dialogue, and recognizing that healing can come from unexpected places. So now let's look at some of the myths and try to tackle them. Myth number 1, is marijuana safe for older adults? Generally, yes, but it depends on the dose, delivery method, and individual health conditions. Risks include dizziness, drug interactions, and cognitive effects. Will it make me high? Well, not necessarily. Many medical products are CBD dominant and non-intoxicating. Remember, THC can be used in low doses for therapeutic effects without causing a strong high. Isn't marijuana a gateway drug? Well, this theory has been largely debunked. Most experts agree that cannabis does not cause people to use harder drugs. Now, context matters. Environment, genetics, and mental health play bigger roles. Next question, isn't it illegal? Well, federally, yes, but 38 states allow medical use. Doctors can recommend cannabis, but not prescribe it. Access depends on your state's laws. Can I overdose on cannabis? It's extremely unlikely. Unlike opioids, cannabis does not suppress breathing. Side effects like anxiety or confusion can occur, especially with high doses. Isn't CBD enough? Well, CBD is helpful for many conditions, but THC also has therapeutic value. The entourage effect suggests that cannabinoids work best together. So, what is the future of cannabis? Well, it looks promising. More states are legalizing medical marijuana, and research is expanding. We may soon see cannabis integrated into standard geriatric care, especially for pain, sleep, and mood disorders. Just imagine a world where your pharmacist offers cannabis capsules alongside your blood pressure meds. It's not as far off as you might think. So in closing, is marijuana good or bad? Well, maybe that's the wrong question to be asking. Maybe the better question is, can it help you live better? And for many older adults, the answer is yes, with caution, guidance, and a willingness to explore new options. As always, talk to your doctor, do your research, and listen to your body. Thanks for joining me today. If this episode sparked your curiosity, share it with a friend and let's keep the conversation going. I look forward to your comments. Thanks for listening. This is Dodie from Deliberate Aging. Until next time, be well, friends. This podcast is presented solely for informational and educational purposes only. Use of information from this podcast is at the user's own risk. It is not intended as a substitute for the advice of your physician or other qualified professional. We are not responsible for any losses, damages, or liabilities that may arise from use of this podcast.